Good afternoon, ma'am. This is Ishita Gupta, roll number 32. Today, my seminar topic is uh, Cooley's hemoglobin or HBC disease. So, here are the contents of the presentation: genetic mutation in HBC disease, inheritance pattern, epidemiology, its clinical features, the diagnosis, the blood smear appearance, and the management and prognosis. So, let's have a look on this disease. So the overview of the Cooley's hemoglobin disease. It's a genetic disorder caused by the mutation in the beta globin gene. Glutamic acid is replaced by lysine at the position 6 of the beta globin chain. It is inherited as an autosomal recessive manner, leads to the formation of a defective hemoglobin C, and it causes mild hemolytic anemia. Now let's see what is the genetic uh, mutation in this. Here in this diagram, we can see that the normal hemoglobin chain consists of glutamic acid at the sixth position. But while we see the hemoglobin C disease, the glutamic acid is replaced by lysine at the sixth position. So it occurs at the codon 6 of the HBB gene, the beta globin gene. It's a single step mutation and it produces an abnormal hemoglobin, that is hemoglobin C. So, what is the inheritance pattern? It's an autosomal recessive inheritance. That means for the person to be affected by this gene, both the parents should carry the HBC gene. Here in the Punnett square, we can see the both parent 1 and the parent 2 consists of the is a carrier of the disease HBA and HBC. So, for the person to be affected by this disease, there should be a carrier parents, and this is a 25% chance of being affected, that is having the homozygous pair, that is HBC, HBC. And for being a carrier, it having heterozygous pair, that is HBA, HBC disease. And 25% chances are the normal individuals with having HBA and HBA homozygous pair. So, where we can see this disease mostly prevalent, from here we can see the map over here. This is a very colored portion, darkest portion, where this frequency of this disease is very much more than 12%. So most prevalent in the West African population, also found in the African American, Caribbean and some Mediterranean population. The carrier frequency can be as high as 2 to 3% in endemic areas. Endemic areas means when the population when the carrier frequency that is having the heterozygous pair of HBA and HBC pair, this is very much frequent in these areas. What are the clinical features of this disease? Usually the clinical features are very much mild symptoms, so no one can generally feel this. That is the mild hemolytic anemia like symptoms like fatigue, pain, pale skin, shortness of breath, rapid heartbeat, cold hands or feet, headache, chest pain can be observed, and mild splenomegaly can be seen. Mild jaundice-like symptoms, that is yellowing of the skin and the eyes, dark-colored urine, and the fatigue at the abdominal pain. Sometimes a person is so asymptomatic that he or she cannot feel that she must be suffering from this disease. So how can we diagnose this hemoglobin C disease? Let us say the hemoglobin electrophoresis. This is a chart of hemoglobin electrophoresis disease. Here in this we can see the HBC pattern is very much dark in color, and the HBA, normal HBA pattern is very light color, but HBC has a very dark on this electrophoresis technique. Other techniques are high performance liquid chromatography, the blood smear, in which we see in the next slide. There is the presence of target cells, and the reticulocyte count is elevated during this disorder. Now here we can see the blood smear appearance of the hemoglobin C disease patient. Here we can see some of the patient PBS can be seen. The RBCs are Anisopoikilocytosis means they vary in the shape. Normally, the RBC shape is biconvex, but